So someone wanted to know about peripontine reticular formation and the sixth nerve nucleus and its relationship to the vestibular ocular reflex, and whether we can use the vestibular ocular reflex to differentiate these two, and also would a lesion in the PPRF ding out your vestibular ocular reflex? In order to answer this question, you have to kind of know a little bit about the anatomy at the level of the pons. You should know that the sixth nerve nucleus, the abducens nucleus, is the final common pathway. So everybody has to come to the sixth nerve nucleus as the final common pathway. That's going to go to the lateral rectus muscle, and there's going to be the interneuron, the MLF, to go to the contralateral third nerve nucleus, which is going to talk to the medial rectus muscle, and that's going to allow horizontal gaze. So if you've got the right sixth nerve nucleus, it fires the right lateral rectus muscle and the left medial rectus muscle to look to the right. However, the peripontine reticular formation also has input into the sixth nerve nucleus. And this guy is in charge of generating the horizontal saccade to the ipsilateral side. So this is a saccade generator. So burst neurons inside the PPRF fire to make you saccade to the right. And so if you have a saccade problem to the right, but no pursuit problem, you know the sixth nerve nucleus can still work. And that is a sign that it is PPRF. The other way we can tell is if we use the eighth nerve, which is the vestibular ocular reflex. So the vestibular system through the eighth nerve talks directly to the sixth. So if we did a doll's head maneuver, generating the VOR, and can overcome this saccadic palsy, we know that the sixth nerve nucleus and everything infranuclear, the lateral rectus muscle, the interneuron, the MLF, the third, are all intact. So we can overcome a PPRF lesion by talking directly to the sixth nerve nucleus via the vestibular ocular reflex. But because these things are so close together, it's very hard to separate out a saccade palsy from a pursuit palsy, and often all the things are damaged. The head rotation, doll's head maneuver, the pursuit, and saccade are all out, and that means you won't really be able to tell clinically between a sixth nerve nuclear and a PPRF lesion because they're so close together. However, if you're lucky enough to have an isolated saccade palsy only, you overcome it with the doll's head maneuver horizontally. There's no lesion in the contralateral frontal lobe that can account for it. That one is PPRF.